Hello, it's Dr. Rafael Gutierrez. Welcome to Anatomy. Today I'm going to talk about the muscle tissues and the embryology of muscles, and it will help you understand how different tissues of the skeletal system, musculoskeletal system in particular, work together to pretty much function. A lot of the things I talk about should help you understand the positioning of muscles as well. And so with that, I do want to start mentioning if the neural tube, which we've talked about quite a bit in the past, and the somites. If you remember, the ectoderm folds in on itself, forming a tube called the neural tube, and the mesoderm forms a bunch of things called somites that are just lateral to the neural tube. As this fuses, you end up having what's going to become the brain and spinal cord, and you have these somites, which they are going to make the bones of the skull and vertebrae eventually, and there is a layer that is going to make muscles. So over here you see the neural tube, you see neural crest cells, which we'll talk about later. The somite is actually broken into the sclerotome, which is going to make the skull and vertebrae mainly. The dermatome will migrate just under the epidermis to make the dermis of skin, and you have the myotome, which is what's going to end up making the muscles for the most part. So over here you can actually see how the muscles are going to develop, neural tube, and you do have the three layers that are going to form the abdomen, which we'll see it a little bit later. Just wanted to show you again the neural tube and how you're actually starting to get the precursors of muscle cells forming the limb buds eventually. And so you end up with these limb buds, bone being formed on the inside. You can see where the gut tube is and the pleura and the pericardium is going to end up being. You can also see again the neural tube with the developing skulls. And one of the things I actually want you to look at is when you're dealing with the muscles, look at how limbs actually develop in something like a salamander, because that will actually show you how the legs, how we're going to actually look at the legs and why they are called a certain thing. Now, the one thing I actually want you to remember is if you look at a baby, and I took this stock image, you can see how their toes, when they sit, point laterally. Most adults, when they sit on the floor, their toes will actually tend to point more anterior rather than lateral. And what happens is the hip joint is pretty loose, and so they fall outward. It's actually how you develop with your legs going to the sides like this. And as you get older, they will end up rotating in. So one of the things I would tell you is if you compare the salamander position and the baby sitting to anatomical position, you can see how the arms are. You can see the legs, again, they would be rotated a certain way in a salamander and in a baby, which the bottom area doesn't really match anatomical position in those areas, but they will be important. Now, what ends up happening is when you start making muscles, you start with something called the myoblast. Myo means muscle, blast means maker. And these giant cells are going to fuse together to form the muscle fibers. And then you're going to actually have the muscle fibers wrapped in something called a perimysium. Peri means around, mysium means muscle. The perimysium will then be wrapped by a epimysium, a bunch of these fascicles, to form pretty much the fascia around this. And you can see how the connective tissue comes to the periosteum. So the epimysium is a top layer, you have the perimysium, and you also have the endomysium, which is around this as well. So the muscle cell is really not a cell, it's a fusion of a bunch of cells. And if you look at this cell, you can see the myofibrils, and they're wrapped around them, you have something called the sarcoplasmic reticulum. The sarcoplasmic reticulum is a modified endoplasmic reticulum. And around that, you do have the sarcolemma, which is a modified cell membrane. And so over here, you can actually see how the arrangement keeps getting smaller. And you can see these thick bands and light bands, which is the reason why it's seen as striated in the microscope. And you have thick filaments and thin filaments. The thick filaments are called myosin, myo again for muscles, thin filaments over here, and these will actually contract, pulling these thin filaments closer together. Now you'll see an area here called the M line, which is an area where you only have myosin, and you have a Z disc where the actin, the thin filaments, are held together. And you have an A band, which has myosin and actin, and an I band, which is just actin. Now, one of the things to remember is the tissue is cells in some sort of matrix. Now, in most of striated skeletal muscle, we are going to be talking about the striated skeletal muscle, but we will have some other tissues such as the dense irregular connective tissue and dense regular connective tissue. Remember, a tissue is cells in a matrix. Now, if this is dense irregular connective tissue, the cells within here are fibroblasts. And in the muscle, this will actually be found around the muscle tissue, around the muscle, to help keep it in place, help it keep it in a compartment. It is part of the epimysium. It is part of the fascia. Now over here you see another tissue you've seen before. You can see the nucleus is squeezed, and you see the collagen fibers in tight, regular arrangements. So again, this is dense, regular connective tissue. And you will find this in ligaments and in tendons. Now remember, a ligament is between a bone and a bone. A tendon is between a bone and a muscle. In this picture, you can see the striations here. So you can see this striped muscle found in skeletons, so it's striated skeletal muscle. And muscles actions, to understand them, you have to look at the anatomical position of the muscle and see how it actually functions. You do have a lot of different movements, such as flexion. Flexion is pretty much decreasing the angle of a joint, which will change depending on what you're looking at. You then have extension, which is increasing the angle. So if you take your elbow, if you bend your elbow, you're flexing. If you're opening your elbow, you're extending. You have abduction, and one of the things to remember is if an alien takes you to their spaceship, they're abducting you. So abduction is to take away, usually from the medial portion of the body. So moving away from the midline would be abduction. Coming towards a midline is adding, so it's adduction. And then you have supination. And the way I tell people to remember that is, imagine if someone hands you a bowl of soup. Your palms go to face upward, and so that's supination. The opposite of that is pronation, which is rotating it so the palms go down. So if your head is here and it moves forward, that would be a flexion. If your arm is here and it comes up, that's a flexion. If it goes down, like in the other picture, that's an extension. If you come up to the side here, that's a abduction. If you come down, it's an adduction. And